Welcome to Sustainable Health Empowerment's Health Education Series. I am Dylan Bruss, and I am a medical student at Western University of Health Sciences, College of Osteopathic Medicine. In the previous 3 sessions, we defined hypertension, identified causes and complications, and discussed lifestyle factors that affect it. In this last session, we will discuss medications used to treat high blood pressure and explore more deeply things you can do to improve your overall health and lessen or even prevent high blood pressure. Today, we will identify a variety of medicines used to treat hypertension and how they work, understand the importance of knowing all the medications you are taking, and identify specific steps to help you control or even prevent high blood pressure. First, let's talk about medication options. All of the medications listed here work to reduce blood pressure in different ways. Your doctor will decide which is best for you based on your overall health and other conditions you may have. The most common are the first 5, so let's look at each of them. The first type of medication we will discuss is diuretics. Diuretics are sometimes called water pills. They help your kidneys flush excess water and salt from your body. This action reduces the amount of fluid in your blood, and your blood pressure goes down. Diuretics often are used with other high blood pressure medications and sometimes are combined into one pill. A typical diuretic is hydrochlorothiazide or Lasix. Now, let's talk about beta blockers. Beta blockers help your heart beat slower and with less force. As a result, your heart pumps less blood through your blood vessels. This action causes your blood pressure to go down. The names of these medications often end with OLOL. The third group of medications listed is ACE inhibitors. These medications prevent your body from making a chemical that causes blood vessels to narrow. The names of these medications often end in pril. Next, we have angiotensin II receptor blockers. These medications also help protect your blood vessels from a hormone that causes them to narrow. As a result, your blood vessels are able to relax and widen, causing your blood pressure to go down. The names of these medications often end in Artan. Finally, there are calcium channel blockers. These medications prevent calcium from entering the muscle cells of your heart and blood vessels. This action allows blood vessels to relax and your blood pressure goes down. The names of these medications often end in PEEN. If you are taking medication for blood pressure, make sure you remember the name and dosage. Write it down along with your other medication you are taking and bring this list with you to each medical appointment. So, now let's return again to an important part of this presentation, what you can do to prevent or manage hypertension. Diet. Consider brown rice, riced cauliflower, or quinoa as alternatives to white rice, with low sodium soy sauce or just citrus flavored sauces that add flavor without salt. Substitute pepper for salt. Stop eating shellfish, such as shrimp, which is high in cholesterol, as well as smoked and salted fish. Instead, bake or broil fresh fish in olive oil and balsamic vinegar marinade with pepper or lemon for flavor. Next, being physically active is important. If you're not exercising at all, start with walking every day for at least 30 minutes. It helps with blood pressure and with stress. Find a walking partner. Increase your time walking gradually and add something more rigorous at least 2 days a week, such as aquafit classes, dancing, or treadmill, or elliptical workouts if your health allows. Maintain a healthy weight. This will not only help your blood pressure, it will prevent other health problems such as diabetes. If you smoke, it's simple. You should quit. There are medicines and patches that can help. See your healthcare provider. And in terms of alcohol consumption, women should have 1 drink per day at most, and men should have 2 per day at most. Try limiting it to only non-working days in an effort to lower your consumption. Last but certainly not least, you should find ways to reduce your stress levels. There are so many options: exercise, music, dance, meditation, social and cultural activities, hobbies such as painting or gardening, and making time for yourself each day in a quiet place. Even talking to a counselor if you feel overwhelmed. These healthy lifestyle habits will help with blood pressure management as well as many other health problems. If you've been diagnosed with high blood pressure, you will need to keep it under control for life by following your treatment plan. Following healthy lifestyle habits, taking medications as prescribed, and continuing to get medical care are essential. While taking these steps will not cure high blood pressure, they will help you keep your blood pressure under control. If you stop your treatment plan, you will be increasing your risk for health problems that are commonly associated with having high blood pressure. Therefore, it is important to continue following your treatment plan closely to stay healthy. If you have been prescribed medications to help you keep your blood pressure under control, it is important that you take all of them as instructed. That includes making sure you know the names and doses of your medications and how you take them. If you have any questions about your medications, ask your healthcare provider or pharmacist. When you run out of your medications, make sure you get them refilled. To make sure you stay on track, don't skip days or cut pills in half. Take them exactly as they are prescribed. If you are experiencing any side effects, make sure to talk with your healthcare provider. They may adjust your treatment plan by changing the dose or prescribing a new medication altogether. Don't stop taking your medications or change your treatment plan without consulting your healthcare provider first. If you've been diagnosed with high blood pressure, make sure to receive checkups or tests as recommended by your healthcare provider. Over time, your treatment plan may need to be adjusted depending on your progress. When you have routine checkups, it is easy to adjust your treatment plan right away if needed. It is also important to keep track of your blood pressure at home. Take a reading several times a week, always at the same time and with the same arm, or both arms, at least an hour after you have taken your medication. Write down your numbers and the time you took the reading. Also note any unusual things going on, headache, stress, or lack of sleep. Make sure to bring these readings to your medical appointment. Now, we will discuss the effects of high blood pressure in pregnancy. Thankfully, many pregnant women with high blood pressure still have healthy babies. But it is important to note that having high blood pressure can harm the mother's kidneys and other organs. It can also possibly cause the baby to be born early and with a low birth weight. If you're thinking about having a baby and have been diagnosed with high blood pressure, make sure you talk with your healthcare provider. By doing so, they can help you take the right steps to keep your blood pressure under control before and while you are pregnant. In some cases, women who have not previously had high blood pressure could have it happen to them for the first time while they're pregnant. In more serious cases, this can lead to a condition called preeclampsia. Preeclampsia can be a life-threatening condition for both the mother and unborn child. Women who are at risk can receive special care during their pregnancy to reduce their risk of developing this condition. With such care, most women and babies will have good outcomes. Today, we have learned to identify a variety of medicines used to treat hypertension and how they work, understand the importance of knowing all the medications you are taking, and identify specific steps to help you control or even prevent high blood pressure. You now have the tools you need to improve your blood pressure and your health. Set weekly goals and hold yourself to them. Thank you for tuning in, and be sure to check out this episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment. We'll see you next week. Here's to good health and to good habits.